Alright, Dr. Wynn here. Here's a case that we started on Friday. So, patient walks in, toothache, limited exam, go over risk, benefits, alternatives. He elects to extract the tooth. Very poor prognosis to hopeless, actually. And as you can see, the gingival overgrowth here is quite a lot. So for me personally, if I cannot see what I'm doing, I need to make sure I can see what I'm doing. So here we are removing the gingival overgrowth, and I wanted to make sure that I can fully see everything that's going on before we get started. So this is the excess gingiva being removed, and here it goes. So now we move on forward, laying a flap. So now I need to see the interface between the tooth and the bone, so I can know exactly what I'm elevating off of, especially if it's poor visibility as it is here on the lower right quadrant. It's pretty far back, so I want to make sure I can see everything, because you can do a lot more damage than not if you can't see it. So right there, you can see the interface between the bone structure, and it looks fantastic. So I went ahead and sectioned the tooth already. I could show you guys videos of how I section teeth later on if that's what you'd like. So here we are, starting to elevate off of the bone, not the adjacent tooth. I want to stay away from that number 30. And then we go ahead and start dislodging the tooth, as so. Making sure you're doing nice, slow, controlled movements here. And I see a lot of mobility right now, which is very good. So we'll go ahead and take our time. Don't rush anything. And then it should come out very soon. There you go. Okay. Now the mesial aspect of the tooth is gone. Now let's go ahead and work our distal aspect. Now I can see the bone as well here, because we removed that excess gingival overgrowth. And then we go ahead and elevate it towards the mesial, and it should separate very soon as well. There you go. What initially started off as a very complicated extraction, if you take a look for a general dentist, turned out to be pretty good if you go ahead and take the right steps that you've learned in your past. So you make something that looks difficult turn into easy if you follow the steps that you've learned all throughout your years. Now we go ahead and place some gel foam here after the sutures are placed. And then I believe I asked for another section as well, because I wanted it to be a little bit more densely packed than that. Looks pretty clean here. And there it goes. There's another part of some gel foam. I personally like to pack it pretty densely. Depending on the practitioner, they're going to tell you otherwise. So other than that, that's pretty much it. Thank you very much for watching, and take care.